So, what do we know about COVID-19? Well, we know that it's a coronavirus. It's one of 26 major families of viruses. It's named for the microscopic appearance of the proteins that are stuck on the outside of the virus that resemble somewhat of a crown, hence the name corona. Coronaviruses are very common. Upwards of 20% of all common colds are actually caused by coronavirus. We know that COVID-19 is a mild disease in the vast majority of people. 85% of people who contract COVID-19 have few, if any, symptoms at all. Another 10% or so actually become ill the way you might with the flu and need to seek medical care, but only a very small number actually require hospitalization. And although any deaths are tragic, only a tiny fraction have died from this infection. We know that COVID-19 is a novel virus, one that hadn't been previously identified by scientists. But that doesn't mean that our bodies have no idea how to respond to it, as you may have been told. Although you may never have seen this exact virus before, our bodies have seen lots of viruses like it, and the immune system is remarkably capable of adapting. An analogy I might make is that although I've never met you, if I ran into you on the street, I would have a good idea how to interact. I'd know that you're a person, not a tree, a man, a woman, tall or short, and I would have a good idea of how to begin interacting with you, even though I'd never met you before. We know that COVID-19 has the ability to mutate or change its appearance over time. All viruses can mutate, but coronaviruses are especially good at it. The reassuring news is that most mutations end up making the virus weaker or less lethal rather than more. This particular virus doesn't do well when exposed to warm temperatures or to sunshine. It simply can't survive for more than a few minutes when the temperatures are above about 70 degrees, and certainly not when temperatures are in the mid-80s or higher. And finally, coronaviruses tend to be cyclic or seasonal in nature, meaning they have normal increases and decreases based on the weather, typically declining in the warmer months and potentially increasing in the cooler, wetter months. And this is why you may have heard that there could be a second wave in the fall.